My name is Michael and I'm your guest lecturer on a session on perioperative nursing. So I've made lots of small segments hoping to break things down and want to look at how we take care of patient safety and patient-centered care. So that involves checklist, but also infection control and VTE risks and so forth. There's a small section also on sustainability, and that includes recycling. Then I sort of give you the description of the different roles in perioperative nursing, and there's three main different roles, and I've used the ACORN standards for that with their role description, and ACORN is the Australian College of Operating Room Nurses. And then lastly, I present a case with nursing considerations relevant to an obstetric patient who is to undergo a lower uterine segment cesarean section. So hopefully if you study midwifery as well, that will make it a bit more interesting to you. All right, so I hope you enjoy the sessions. I've left my contact details with Alan Dyke. So if you have any questions, I'm more than happy to answer them to you. I hope you enjoy perioperative nursing and come back to us on a placement and even on a grad program, even better. All right, thank you. Bye. So this last part of the introduction, I just briefly want to mention you the fact that perioperative nurses, and all nurses really, have a role as being a patient advocate. So nurses are stewards and guardians of patients during their entire perioperative journey. We tirelessly do our utmost to prepare our patients before starting surgery without missing a beat. We speak up for their safety. We do our utmost to prevent patients from acquiring infections. We know of their anxiety and uncertainty about the surgical process and provide cultural safe support, for example with using interpreters. We use our expertise to prevent any deterioration, and we work with the medical teams to enhance our patients' recoveries.